I think it's important to get a diagnosis and it's important to have a treatment plan. Not only because it really changes the way a person can interact in their life, the ability to consistently show up in a place and do what you intended to do, also because there's some evidence that suggests pretty conclusively that if someone has migraine and they don't have an effective treatment strategy, it's a marker for worse outcomes over time. What I hear from many patients is that they do not want medication, or they've tried a few medications and it's not a good option for them. Or it might be a good option, but it's not a good option all the time. The Ren wearable has been FDA cleared for both acute treatment of migraine and for the prevention of migraine. And that's where I see it being just the most helpful for patients. It gives them these strategies, these options to kind of layer their care so that they have enough treatment when they need it. With too much medicine, a migraine disorder will worsen. And the nice thing about the Ren wearable is that's not a component of how it works. It's not a pill, it's not a drug, it's not all over in your body doing other stuff we don't want it to do. For some people, it works better than medicine. For some people, it's the only thing that works. And for some other people, it's something that can be layered in so that as someone has an attack, they really have the control. They can decide how they want to manage it. There is good evidence that when it works, it continues to work. What's cool about a device like this is that it gets the brain to release its own drugs, its own serotonin, its own norepinephrine. So when the brain gives itself its own medicine, we don't tend to see the things like the nausea and the drowsiness and all of these other things that are so common with drugs. It is interesting being a neurologist and a migrainer and then having gifted this disorder to my kids as well. My daughter is currently 14. She started having migraine when she was 5. She was given acute medicine, she was given preventive medicine, and as she's aged, she has had a variety of responses to those treatments. So her pediatric neurologist prescribed her the Ren wearable, started to get a migraine, came home early from school, and she put it on her arm. She opens her phone, she starts the treatment, and sat at my kitchen table for 45 minutes. And it was like watching a plant that was dehydrated after you realize you forgot to water the plant and you give it a little bit of water. She's kind of pale and droopy, and then she just became my daughter again. And she got the biggest kick out of the fact that I got the biggest kick out of it. She said, "Mom, you talk about this all the time. You're constantly telling patients that this is something that might work for them." And I said, "Yeah, but I've never actually watched the whole thing happen. That was kind of remarkable." She said, "Yeah, this is how it works." Took it off her arm, put it back in the box. She went out to play with her friends. And so it's really been cool, as a provider, but also as the mom of a migraine patient, to be able to see how something like this really can impact someone who has migraine. The nice thing about the Neurivio app is that it will log the treatments. Just about every physician or every healthcare provider who's going to treat a disorder that has episodes or attacks, they want to see that diary. Having the ability to chart something like that becomes a lot easier when the device does the charting for you. For some patients, this is appropriate as a first-line treatment. And I think specifically about kids who are in school, who getting up, taking a pill, coming back and sitting down and trying to focus while their brain is under the influence of a medication, that may not be the best thing. Someone who's pregnant, who's being very cautious about what they put in their body, this really might be a better first-line option. And so I think it's got to be individualized, just like all of our healthcare, to the person who has the migraine disorder in discussion, talking through the options. But I think we need to think about it sooner.